Hi and welcome, it's me, Dr. Phil, and today's Start of the Week video is all about beliefs. Now when I say beliefs, I'm not talking about your individual spiritual or religious beliefs. I'm talking about the way that you see the world, but a very particular way. Because the key thing about beliefs is they show up as truth. They're our kind of version of how the world works. But the thing about beliefs is sometimes they're absolutely accurate and sometimes they're an approximation to how reality really is. But because there are beliefs, we don't see them as that approximation, we see them as truth. And this is where we can get stuck. So with beliefs, we can think certain things about ourselves to be true that just aren't true. Now, sometimes it could be really powerful. It could be like, I'm a successful person, everything I do works out well. That might be useful. But sometimes we can have beliefs like, I'm always the kind of person that gets left out or gets that cold or bad things happen to. And those kind of beliefs are not so useful. And the key thing to remember about beliefs, which I'll say a number of times, is the question you want to ask about beliefs is not, are they right or wrong? Although that is a useful question, the most useful question to ask is this belief useful for me? Does it help me? So if you're thinking about jumping from a great height and imagine you can fly without wings, it's probably not a useful belief. If you're thinking, you know what, I think if I try something, I've got a really good chance of finding my way through it. That's a really useful belief. Now, neither of those are necessarily true, but one may be more useful than the other. So it's a general idea about beliefs. The key thing with beliefs is to spot them, which we're going to be looking at in another vlog that I'll be doing. But being able to recognize what is the significance of these beliefs for you. Are they helpful? Are they not helpful? And before we spot them, let's have a little talk about what they can do for us. So a disempowering belief, a belief that is not useful, is incredibly powerful. So a lot of the research into this comes from looking at placebos in terms of health. I mean, there's lots of psychological effects of beliefs, but beliefs have a direct impact on our health. So in the study of placebos, which I often talk a lot about, is where you're given a pill or an intervention that contains nothing of value. It's just a pretend or sham pill, and that's compared with the real thing to see how much better is the real thing from the pretend thing than from the placebo, because we know that just by giving a pill or giving an intervention there is some benefit. What's interesting is the effects that people get from the placebo, so that they can get positive changes even in things like placebo surgery or in response to placebo morphine, all sorts of extraordinary experiences. But there's the dark side of placebo, which is nocebo, which is where people get a negative response from taking the pill that contains nothing. So they will get side effects. So in one study, they gave people a placebo, and they're comparing to a normal drug, and the drug had 3 types of side effects, one of which was digestive system side effects. And in the study, they were doing it at a number of different locations, and in one hospital where they did it, they forgot to photocopy the side effect sheet correctly, so that only 2 of the side effects were mentioned. The digestive system side effects weren't on the piece of paper because they hadn't photocopied it effectively. They gave out these leaflets, these warning leaflets, and guess what happened? Well, in the hospitals where the patients received the full list of side effects, they got the full list of side effects. In the hospital where they'd failed to warn them about the potential side effects in their digestive system, they didn't get these side effects. So that's an example of placebo, or nocebo in this case. So our beliefs, our expectations affecting what happens in our body. So we're getting a pill with nothing in it, and because they read this leaflet, it doesn't contain any information about warning about your digestive system, they didn't get any digestive system problems. One of the things I often quote, which I think is so important, is a conversation I had with Professor Andrea Avers. She's a kind of leading scientist and researcher. And I said to her, having studied a lot of stuff around placebos and the mind-body connection, the way how we think affects our neurology and our physiology. I said, what's the key thing that you've learned that you would take away, you would share with somebody? And she said, if I was going to have an operation, or if I had a friend who was going to have an operation, and they said to me, I don't think the operation is going to work, she says, I would advise that person to not have the operation. Do not have the operation yet, because there's so much neurology pointing in the direction towards this isn't going to work, so belief, expectations, this is not going to be successful, that is enough to undo the potential benefits, or at least some of the potential benefits of the operation. And you don't want your system to be pulled in those two different directions. She says, spend some time talking to the doctor, choose a different surgeon, find out people who've had success, get your head straight, thinking, yeah, this is going to work for me. Because if you combine good intervention plus your beliefs, your expectations, pointing in the same direction, then you're going to be maximizing your chances of getting the change you want. And if you're in that position where you have a good intervention, but you're thinking it's not going to work, that will drag away from that success, and you just don't want that. And that's coming from, someone who's a really, really straight scientist saying, this is too important. We need to pay attention to this. So if our beliefs can affect our physiology, our response to interventions, whether it's side effects or positive effects, then we really need to pay attention to what are our beliefs. So the question for you this week is, what beliefs have you noticed that are getting in the way of you having the life you love, having a great week? Are you expecting something about this week that maybe isn't useful for you? Not is it right or wrong, false or true, but is it useful for you to hold on to that belief? What are your beliefs about yourself? What are your beliefs about your health? What are your beliefs about others? So start there. Check in with your beliefs. Find out what you're believing. And we'll look at how do you spot them more clearly. There are certain cues and clues. And of course, how do you change them? But the first thing is just to become aware of what you're thinking, because beliefs masquerade as truth, and we need to lift the curtain, peel back the carpet and find out what's going on, what are we thinking. Then we can start to change it. Hope you found that useful. Have a great week. I'll see you on the next one.